Hai, salam ceria. Saya Dr. Bubi dari My Dental Care Sungai Besi. So hari ini saya diberi tanggungjawab untuk beberapa soalan yang kita selalu come across. Kenapa kena buat rawatan di My Dental Care Sungai Besi, this branch? Sebab we My Dental Care Sungai Besi, we offer a wholesome treatment and we prefer quality rather than quantity. So when you come here, you know that you're going to get the right treatment for your problem rather than just any treatment to relieve your problem at that moment. So when you come, you get to do treatment, also to consult every other teeth before you actually just go back with your problem being solved. So we offer that kind of treatment, and that's why you should come to My Dental Care Sungai Besi. Apakah keunikan My Dental Care Sungai Besi? Saya permanent officer ke sini, so saya keunikan My Dental Care Sungai Besi. Besides that, we have other staffs and other doctors too who come in and go. So we are all hopefully friendly, and we make you feel at home when you come in and when you walk out with a bright smile. So the keunikan is definitely the treatment that you get here also. We offer really good treatments and with really reliable doctors and staff. And also the price is very, very affordable. So I can say you get everything when you walk into My Dental Care Sungai Besi. Kesedaran mengenai penjagaan gigi di kalangan masyarakat. So I can say kesedaran sekarang memang dah quite vast sebab social media obviously. So dah ada too many comparisons of before after gigi, or about any trouble of losing your teeth or pain or how to manage, or even clinics nearby you. So with more doctors talking about it and posting about it, whether it's just a funny video or something serious, people are actually coming across the importance of dental health care. So, but of course we still have the tanggungjawab to reach out to those who are in the rural areas or those who have no access to social media. So we try to give more talks, we try to go to the areas to talk and all that. But I can say the awareness now is much more better than maybe just few years back before social media became a thing in this world. So quite happy, but there's still a lot in dental health care. And the final question is my advice during this pandemic of COVID. So my advice is we operate as normal, but we follow the SOPs, we follow the rules and regulation given, the guidelines. So you don't have to worry because in between all treatments we do sanitize everything that we use, and we are in proper PPE, and we make sure that appointments are not given so close by, so we have time to do the cleaning, and also we limit patients coming in, and we limit any peneman for the patient so that we don't have much crowding in the clinic. At the same time, if you are in pain or anything, just give us a call because we are operating like normal and we are going to help you out in your pain. So don't think twice. We operate normal hours also. Just give us a call, set an appointment, and we are ever ready to help you. Thank you.
Salam ceria, selamat datang ke My Dental Care Sungai Besi. Kami menyediakan layanan mesra kepada pelanggan kami. Seterusnya kami mempunyai promosi Tooth Dental, package Sparkle dan package Shine. Waktu operasi kami dari 9 pagi hingga ke 9 malam. We care your smile. Selamat datang ke My Dental Care Sungai Besi. We care your smile. Thank you.
Periodontal disease begins in the gingival sulcus, a cuff of soft tissue around the necks of the teeth, where they emerge through the gums. Healthy gingiva are pink in color, and the sulcus depth ranges from 0 to 3 millimeters, measured from the tip of the gingival margin to the base of the sulcus. The attachment fibers connecting the gums to the teeth and the teeth to the bone are intact. The gums are resilient and neither bleed nor hurt when being probed. During meals, food debris accumulates in the sulcus. When mixed with mouth bacteria and proteins from saliva, plaque and less obvious biofilm are formed. Both are harmful to teeth and periodontal structures. Left in place on the teeth, bacterial plaque and biofilm begin to mineralize, forming hardened deposits called calculus, which can only be removed with dental instruments. In response to the increased bacteria adjacent to the soft gingiva, the body sends immune cells and healing cells to the area by way of the circulation. The increased blood flow to the gingiva produces red, enlarged, and tender gum tissues, a reversible condition known as gingivitis, in which the periodontal attachment fibers remain intact. Continuous exposure to acids and enzymes from plaque bacteria and the body's immune response to them eventually causes the periodontal attachment to be lost, an irreversible condition known as periodontitis. The sulcus depth increases to the point where the patient can no longer effectively remove plaque, leading to the destruction of tooth-supporting bone. Smoking impairs blood flow and can significantly interfere with a patient's ability to fight the bacterial infection. Other factors may be involved. Generalized periodontitis affects all of the teeth. They may loosen, appear unnaturally long and unattractive, and may ultimately be lost. When multiple back teeth are lost, the front teeth may be unable to support closing forces of the jaw muscles. They begin to tip and move. The cheeks begin to collapse inward where the back teeth are missing, and the lack of proper support for the jaw joints may cause them to ache, pop, and click. Periodontal bacteria can enter the body's circulatory system through leaky blood vessels. Once inside, the bacteria can lead to blood clots and inflamed vessels, which constrict in diameter, leading to strokes, heart disease, heart attacks, and poor circulation in the extremities.
Okay, hai, Assalamualaikum dan salam ceria. Bertemu hari kita petang ini dalam Tanya Dentist. Okey, untuk tajuk yang akan kita bincangkan petang ini agak familiar juga dan agak common juga yang sering berlaku di kalangan kita kini. Okey, tajuk yang akan kita bincangkan hari ini adalah berkenaan dengan gum disease atau lebih dikenali sebagai penyakit gusi. Okey, apa itu penyakit gusi? Itu yang kita akan bincangkan petang ini. Sebelum itu, mari kita perkenalkan salah seorang officer kita iaitu Dr. Terry. Hi, Doktor.
Hi.
So how are you, Doctor?
Good. How are you doing?
Yeah, I'm good too, Doctor. Okay, so Doctor, hari ini kita akan bincangkan berkenaan dengan gum disease ya, ataupun penyakit gusi kan?
Yes.
Okay, so bagi pengetahuan semua, ini Dr. Terry merupakan salah seorang officer di klinik pergigian My Dental Care. Bagi sesiapa yang ingin bertemu dengan Dr. Terry, boleh datang ke My Dental Care Kota Damansara. Dan Dr. Terry merupakan salah seorang officer kita yang kids friendly. Bagi sesiapa yang ingin bawa anak-anak ke jumpa dengan Dr. Terry, boleh datang ke My Dental Care Kota Damansara. Okey, so tanpa melengahkan masa lagi, mari kita teruskan perbincangan kita pada petang ini. Dipersilakan Dr. Terry.
Yep. Okay, hi. Good evening. I'm Dr. Terry from My Dental Care Kota Damansara. Most of the days you'll find me here in Kota Damansara. Alright, today I'm going to talk a bit on gum disease. Alright, mana slides Can I get the slide on? So, gum disease is one of the most common disease in the oral cavity, alright, as close as to dental caries. Okay, so what is gum disease? Right, next slide please. So in basic terms, it is just inflammation of the gingiva, all right, usually caused by bacterial infections, all right. If you leave this untreated, if you slowly lead to a more serious condition called periodontitis. All right. From what I see, most Malaysians have periodontitis and gingivitis. All right. Maybe because of low awareness. All right. Yeah. All right. All right. We're going to talk a bit on the sign and symptoms of gingivitis. All right. Next slide, please. All right, very easy to spot on gingivitis. All right, our healthy gingiva is usually pink in color. All right, if it's a gingivitis disease gum, usually it's reddish in color. All right, the gingiva is swollen, slightly swollen. All right, the gingiva bleeds easily, especially when you brush. All right, very easy to spot on is when you brush, it has blood. All right, um, if you brush too hard, of course, there will be bleeding also. So if you're not sure, please come to a dentist. All right. Gingiva that's tender. Tender as in like when you touch, it feels pain. This one is quite rare, but it does happen to few patients. Okay. Next, please. All right. This is a comparison photo. We can see a healthy gum is usually pink in color, right? A gingivitis, you can see is reddish. You can see the neck of the tooth. The gingiva surrounding it is reddish. All right. If you touch it, you probe it, it will bleed easily, all right? Yeah, I will talk a bit on the periodontitis also. Yeah, next slide, please. All right, all right. Periodontitis is almost the same as gingivitis. You will have the same sign and symptoms: reddish gingiva, swollen gingiva, gingiva bleeds easily, tender gingiva. But what else it makes the difference between these two is that, next slide, please. That the gingiva will recede. All right, when it recedes, your tooth will appear to look longer. Okay, it will slowly leads to loss of teeth or tooth, and when we probe it, there's a pocket in the gingiva. Usually, the gingiva pocket is about 0 to 3 mm. That's what they said in the video. But usually, what we get is 2 to 3 mm. All right, rarely 0, 2 to 3 mm. If you probe more than 3 mm, we suspect a bit of periodontitis. Okay. Right, knowing the sign and symptoms, okay, this one is the photo I can show you. You can see the difference. Usually, healthy gingiva, you only get 2 mm pocket like that, right? When it's gingivitis, you won't get any pockets. Still 2 mm pocket. If it's a periodontitis, you start to get pocket more than 2 mm, 4, 5 mm. There will be bone loss. Okay, the bone loss will cause the mobility in the tooth, right? That's why our tooth will have mobility. Right? Next, please. What causes gum disease? All right, the most common cause is plaque and calculus. What is plaque? Plaque is those yellowish substance you can find on your teeth after meal. All right, as fast as a few minutes after brushing, we start to form. All right, it has your saliva, your mucins, food debris, dead cells. All right, all this is the place where the bacteria will grow. Okay, so plaque don't only cause gingivitis. If you left it after some time, this plaque will harden. All right, it will demineralize and form calculus. All right, tata. Right, usually you can remove plaque by brushing, but for calculus you have to remove it by scaling. A dental visit, only a dentist know how to remove it. Okay. Next, please. This is usually the cause. So about risk factors, all right. As usual, poor oral hygiene, you don't brush properly, you don't take care of your oral hygiene well. If you lead this to gingivitis because the plaque is slowly formed to calculus. All right. Smoking, all right. In smoking, people who tend to smoke will tend to have a reduced immune defense system towards the bacteria. Okay. So after removal of calculus, all right, the healing is not as good as the response to this treatment is not as good as normal people. All right, so there's a risk of it. Or if you have a periodontitis and then you're a smoker, the response to treatment is more poor compared to a healthy patient. Okay. Next one, diabetes. Okay. Diabetes and periodontitis actually will cause each other. All right. With poor control diabetes, poor sugar level controlling, it will cause uh, increase in sugar level in your saliva. All right. This one will form a very good environment for your bacteria to grow further. Okay. And it will thicken our basement membrane in the blood vessel, causing poor immune system response. Okay. And then a poor healing, all this will slowly lead to periodontitis or worsen it. Okay. For hormonal changes, right? Usually, if you can see pregnant ladies, they have hormonal imbalance or during puberty, the gingiva is more sensitive and it will inflame easily. Okay. Yeah. Next, please. So for treatment of gum disease, the best way of treatment is definitely prevention. Prevention is by having good oral hygiene. All right, you quit smoking. Okay. Practice healthy lifestyle, eat healthy diet. All right, reduce your sugary food. All right, more on fibrous food. Have dental checkup. Dental checkup regularly. Over here we recommend 3 to 6 months checkup. Every 3 months checkup is better actually. So scaling at least done to be done twice a year. Okay. So if you have gingivitis, what can we do? All right. Usually gingivitis, you just do scaling, remove the calculus. After a few days, the gingiva will start to heal. All right, and the bleeding will reduce. All right. If it's a periodontitis, so periodontitis, there are many ways. It depends on the stages. If your stage are quite early, maybe just a simple scaling and root planning will do. If it's at very advanced stages, maybe you need to do surgery, usually done by specialists, right? Or there are prognosis that is poor, meaning that we don't expect much positive outcome from the treatment. Usually will lead to loss of tooth, right? There's nothing much we can do lah if it's a very, very advanced stage. Okay, so it's better to prevent all this from happening. And the moment if you lose your teeth, there will be missing tooth. It will affect your mastication, your eating, your speech, your aesthetic, most importantly. And that's why we recommend actually if you lose your tooth, get some tooth replacement on top of it. All right. Yeah. Next, please. That's about it. Just a repeat. All right. That's about it for today. Yep. Thank you.
Okay, thank you Dr. Terry for all the explanation. Okay, memang sangat detail dah faham. And then I ada soalan yang untuk diajukan kepada Dr. Terry. Okay, seeloknya berapa kali kita harus gosok gigi dalam masa satu hari?
Minimum 2 times. All
2
right.
times.
For me, I recommend 3 times. Yeah, 3 times. Morning after wake up, evening shower time, and night before sleep.
Okay,
Yeah,
so kalau berkenaan dengan floss, berapa kali patut kita floss setiap hari?
every time when you brush, you're supposed to floss. But of course, if you're busy, maybe morning and night must.
I see. Okay, doktor. And then one more question. Untuk buat scaling, sepatutnya berapa kali patut kita buat scaling dalam masa 1 tahun?
That's a very good question. So minimum we do twice a year. Every 6 months is recommended. But some people need every 3 months. Very fast calculus form. I've seen a few patients that form calculus really, really fast, even 3 months. So just like that, I would recommend 3 months to 6 months. So it depends on patient to patient, right? So best to do every 3 months.
Okay, so last question. Start age berapa yang sesuai untuk lakukan scaling?
Age
Umur berapa?
berapa?
Umur.
Alright, so the best age to start is best age. Alright, usually for me, 12 years old and above, you require scaling already because after 12 you have all your adaptive. Okay. Some kids below 12, I would do localized scaling, meaning scaling on a few adult tools that has calculus already. So there's no suitable age or something that there's more to like suitable timing or suitable condition for us to do it.
Okay, thank you. That's all for question today. Okay, so yang mana sedang menonton kita punya live hari ni, okay, bagi pengetahuan semua, jika mempunyai sebarang pertanyaan, boleh je komen dekat bawah dan nanti saya akan baca dan soalan anda yang ingin anda tanyakan. Okay, sebelum itu, mari kita tengok promosi untuk bulan 7 ini sebab seperti yang anda tahu kan, setiap bulan kita mesti adakan untuk promotion macam bulan lepas untuk promotion Jun telah pun berakhir. So sekarang untuk promotion bulan Julai, mari kita tengok promotion apa yang ada. Mesti semua orang tak sabar kan nak tahu promotion yang sedang berlangsung pada bulan ini. Okey, mari kita saksikan promotion yang berlangsung. Okey semua, bagi pengetahuan semua, sekarang ini kita tengah ada promosi iaitu RM7 untuk pemeriksaan gigi. Dan dapat percuma satu batang bambu toothbrush iaitu berus gigi kita, okey. Okey, RM7 je. Harga yang sebetulnya untuk consultation adalah RM40. Tapi kali ini sempena promosi bulan Julai, kita bagi RM7 sahaja. Dan consultation ni valid sehingga 6 bulan. So dah tempoh 6 bulan. Kalau anda datang untuk buat treatment lain dah tempoh 6 bulan, kita akan charge lagi untuk consultation. Dan after 6 bulan tu baru kita akan charge mula untuk consultation. So bagi sesiapa yang rasa dah lama tak buat check up gigi tu, bolehlah grab promosi RM7 ini. Okay, so sangat berbaloi. Dan seterusnya kita ada promosi untuk scaling dan polishing. Scaling dan polishing hanya RM107. Jika anda ini tambah dengan whitening home kits, harganya ialah RM277. Scaling dan polishing ini harganya sebetulnya adalah 100 sehingga 200 mengikut keadaan karang gigi. Tapi kali ini kita hanya bagi RM107 termasuk dengan consultation dan juga free lagi bamboo toothbrush satu set tau. Satu set bamboo toothbrush tu mempunyai 3 batang berus gigi. So memang sangat berbaloi kalau boleh grab package yang sekarang kita tengah ongoing sekarang ni. Okay? So jika mempunyai sebarang pertanyaan, boleh je tanya kita dekat nombor yang tertera di bawah dan kita akan jawab segala persoalan. Okay, next kita tengok apa lagi yang ada promosi pada bulan Julai ini. Okay, ini adalah good news juga bagi semua yang sedang bercadang untuk melakukan rawatan gigi palsu. Gigi palsu ini bagi sesiapa yang ingin melakukan rawatan gigi palsu, kita akan memberi 17% diskaun. Ini tak mengira usia ya, tak kisahlah umur berapa pun. Sempena Hari Raya Aidiladha ini kita akan beri kepada semua yang sedang bercadang untuk melakukan gigi palsu dan diskaun 17%. Okey, bagi pengetahuan semua, kita punya dekat gigi palsu kita dekat sini ada 3 jenis iaitu acrylic denture. Acrylic denture kita yang berharga kita punya acrylic denture, kita ada acrylic denture, double pass denture dan juga compact denture. So semua ini anda boleh dapatkan di semua branch klinik pergigian My Dental Care. Okey, kalau anda mesti lagi macam tertanya apa beza semua denture ni, boleh je WhatsApp kita ataupun hubungi kita. Kita akan jelaskan semua jenis denture dan semua jenis dan juga segala pertanyaan anda. Okay, so bagi untuk live kita petang ini, saya rasa sebelum itu last sebab tadi saya ada perasan ada yang tanya berkenaan dengan braces. Okay, kita punya promo untuk braces iaitu untuk conventional braces yang bernilai hanya RM599 sahaja deposit termasuk consultation dan juga study model. Bagi pengetahuan semua, study model kalau kita tak ambil package ini, harga untuk study model adalah RM150 dan juga consultation RM40. Tetapi ini dah termasuk sekali dengan deposit. anda hanya perlu bayar RM99 sahaja untuk Grab promo ini, dan bila lagi selebihnya anda boleh bayar semasa rawatan dan juga atau semasa bonding nanti. So untuk professional braces ini valid sehingga 31 Julai ini, dan anda boleh bonding sehingga 31/8. So bagi sesiapa yang sedang berancang ingin tahu berkenaan dengan package braces yang kita ada sekarang, boleh je datang ke klinik kita untuk konsult dengan doktor terlebih dahulu. Seperti yang Encik Al-Hafizin tanya, berapa harga pemasangan braces? Okey, harga untuk pemasangan braces adalah anggaran RM5,000 sehingga RM8,000 untuk conventional braces. Dan untuk bayaran bulanan adalah serendah RM150 sahaja. Dan jika berminat, boleh je Grab untuk promo braces yang sedang kita jalankan sekarang, iaitu hanya perlu bayar RM99 sahaja dulu untuk Grab promo ini, dan balance anda boleh bayar selepas melakukan rawatan ataupun semasa bonding. Okay, so itu saja untuk live kita petang ini. Thank you Dr. Teris untuk segala explanation yang telah doktor berikan berkenaan dengan penyakit gusi ataupun gum disease. Kita sangat membantu bagi sesiapa yang sedang telah mengalami masalah gusi tersebut. Agak common juga di kalangan kita kan, mengalami masalah gusi berdarah dan sebagainya. Saya harap apa yang dibincangkan oleh Dr. Terry petang ini dapat membantu segala masalah gusi anda, juga dapat menjawab segala persoalan yang anda tertanya-tanya berkenaan dengan gusi anda. So itu saja untuk pegang ini. Thank you Dr. Terry. Sehingga kita berjumpa lagi di next live. Bye.